I'm Julie Pace, Washington Bureau Chief for the Associated Press, and this is Ground Game. The coronavirus pandemic ranks among one of the most consequential stories ever covered by the Associated Press in its 170-year history. Here to take you inside the outbreak is AP's Ralph Russo.
From the Associated Press, this is Inside the Outbreak. I'm Ralph Russo. Today is Friday, April 17th. The coronavirus pandemic has thrown China's economy into its worst economic downturn since the 1960s. Here in the U.S., the one-day death toll of more than 4,600 reported Thursday was the highest yet. The number of unemployment claims in the U.S. rose another 5.2 million, bringing the four-week total to a staggering 22 million. On this episode of Inside the Outbreak, we turn our attention to India, and we'll be joined by Emily Schmall, AP's South Asia correspondent based in New Delhi. We'll talk to Emily about how India is ramping up its fight against the pandemic after a late start. That's the sound of the world's largest lockdown. Emily will tell us what it looks like and how it is impacting the more than 175 million people who live in poverty in India. Emily Schmall is AP's South Asia correspondent based in New Delhi. Emily, thank you so much for joining me today on Inside the Outbreak.
My pleasure.
So India is a country of about 1.3 billion people that neighbors China. Currently has about 13,000 confirmed cases of COVID-19. And as of this interview, Ireland, which has a population of about 5 million, is about the same number of cases. So, Emily, what's the latest in India where it seems as if the worst of the pandemic is still to come?
Yeah, I think we've seen this pandemic enter regions at different times. For a variety of reasons, it got to Europe faster, even though India is right next door to China. Europe and China have far more connectivity, especially by air. So I think in India, we have yet to see the peak, and we may, in fact, not see it for a couple of months at this stage for a variety of reasons.
Prime Minister Modi and his government are being criticized for a slow response to the outbreak. You reported India's first coronavirus meeting took place January 8th, and its first case was detected about 3 weeks later. But it took another 40 days for a response. What opportunities do you think were missed in India?
So actually, for a long time, there were only 3 cases in India. They were all in the South Indian state of Kerala, and they were all students who were in Wuhan, the epicenter, and had come back to India, where they were immediately quarantined and recovered. And so I think there may have been this false sense of hope that the problem had been contained, and therefore India didn't need to make a lot of preparations for a huge outbreak. I have to keep in mind that India, despite being one of the world's largest economies, is still a poor country. It has actually the largest population of extremely poor people anywhere in the world. So resources that go toward COVID-19 are taking resources away from other significant problems. Actually, my AP colleagues reported today about the fact that in many countries in the world, including India, there are a lot of concerns that the money being spent now to control the coronavirus is taking away resources from other infectious disease programs. So I think, this was just a cost-benefit analysis. And in January, the government didn't foresee this becoming an enormous problem. If it did contemplate it, it still felt it was wiser to wait and watch rather than expend on something that may not materialize.
Was there anyone within India, any parts of the government sort of sounding some alarms?
Yeah, I think so. I think from the beginning, epidemiologists were concerned. India borders China, and while it's less connected to China than some other places, it still has a lot of incoming travel. And it's a huge country with a very, very feeble healthcare system. So people who look at this were concerned from the beginning, from the moment that the epidemic was announced in China, that if it did reach India, it could be catastrophic. And I think early on, there were doctors, there were former health officials suggesting that India should be doing more, but they were ignored. In fact, the Indian government's own top medical research body put out this mathematical model in February that stressed trying to mitigate rather than contain the virus. So, and they were kind of criticizing the government at that point in February, saying, look, you're screening passengers at airports, but that's not enough. We need to be testing more, and the screening needs to be expanded. But the government, for whatever reason, didn't take that advice for a really long time. In fact, the government has only recently started ramping up testing. The criteria that it was using was some of the strictest in the world. For many, many weeks, it refused to test people who were showing up with COVID-19 symptoms if they weren't willing to sign a form, essentially, that said they had confirmed access to somebody who was sick or direct access to somebody who had traveled from one of the worst affected countries. So I think a lot of people fell through the cracks at that point, and there was a lot of travel internally and outside of India by people who very well may have been sick.
You just mentioned some travel internally. Can you describe what is happening with India's migrant workers, the day laborers who live off basically daily earnings?
Yes. So I think, from what I understand, talking to epidemiologists, whenever there is an epidemic of this kind of scope, governments are always challenged with preparations but trying not to create panic. And so on Sunday, March 22nd, India had basically a trial lockdown where Prime Minister Modi asked everyone to stay in their homes, and at an appointed time said we should all go outside and clap and cheer for healthcare workers. And the writing was on the wall at that point that there might be a lockdown, but it wasn't announced until 2 days later. Modi did a live televised address and said essentially that the entire country was going to be on a near total lockdown, with people only allowed to go out for essentials like food and medicine, and very few businesses allowed to stay open. And he said it would all begin within 4 hours of that speech. So we saw people rushing to railways, to trains, to try to get back to their villages. I think partly out of concern of being dislocated from aging parents, from other relatives. A good number of migrant workers are men who have migrated to big cities and send remittances back to their home, back to their families and villages. So these were people who saw that their work was going to dry up and they better get back home soon. But then Indian Railways did something unprecedented, which is it shut down all passenger service. So you had this sort of epidemiological nightmare of people crowding at railway stations, trying to find a way home. And for days after that, we saw people leaving the city in droves on foot, sometimes with nothing more than flip-flops, prepared and walking hundreds of kilometers, hundreds of miles a day in an attempt to reach home. And after about 5 days of this, the state governments of Delhi, the capital, and the adjacent state of Uttar Pradesh, where many of these migrants were heading, decided to send a fleet of buses to get these people off the roads. And they essentially then quarantine these people in empty schools and other empty public buildings with not a lot of creature comforts, little food, little water, not necessarily the most hygienic conditions, but they didn't want them to, it was all about staving off the pandemic from reaching rural areas. And this is really critical to the Indian government's overall approach. To date, the Indian government says that India is not in stage 3, which is community transmission. And they say this because there are still hundreds of districts around the country where there are no reported cases. So they've been adamant that they would identify clusters, they'd identify hotspots, and do a lot of testing there and try to contain and seal off those areas from the rest of the country. So their worst fear was that these migrant workers would reach the villages and essentially infect all sorts of people with little to no access to healthcare. So at the moment, there are an unknown but certainly huge number of people quarantined for 14 days in schools and other public buildings. And it remains to be seen, really, whether that tactic will prove to have kept the crisis from reaching the most distant and least resourced parts of India.
Well, that's quite a tale, because my next question was, how does a lockdown in such a densely populated country work? And I guess part of it is what you're saying, getting away from trying to restrict travel in a place where there seems to be a lot of travel as people try to scramble to get back home and things along those lines, or back closer to what would be normally home. What does the lockdown look like, and how else is it being enforced, again, in such a densely populated country, 1.3 billion people?
When Prime Minister Modi told the country that everyone was going to have to stay home for 21 days, he said, don't worry, the government has enormous food stocks, has sufficient medicine, and we will distribute these things to you. He didn't really say how or when, so a lot of people didn't wait. The people who are at the very bottom of the economic ladder here, who only had a day or two of food at home, decided they wouldn't wait to find out how this massive distribution program was going to work and whether they would benefit from it. These are the people who left their homes and cities for the villages. But others have stayed, people who are in low income programs that already exist and already receive food rations are receiving even more rations. So people who have these ration cards are receiving food. There are some people who are receiving direct cash transfers. And again, the idea is that the government can keep people inside and in their homes if food and other necessities are brought to them. Then they'll be less likely to rebel or out of desperation to leave their home. But the problem is, of course, that a lot of people fall through the cracks of these programs. A lot of people are in the informal sector. Actually, India has an enormous informal sector. It comprises 85% of the economy. So a good number of these workers who are essentially day laborers, who may do some construction one day and may work in a tea shop the next day, they're looking for work every day, aren't necessarily going to be on government registers and therefore aren't in a position to receive the food or medicine rations that the government is providing. So there are all sorts of schemes that are being promoted right now by some of India's top economists to kind of spread the wealth and make sure that everybody has access to these things. But in the meantime, just this week, we saw a riot involving hundreds of people protesting the lockdown, which was extended just this week for another few weeks. There were hundreds of men at the railway station of Mumbai who were day laborers and who insisted that if this lockdown continues, they would die of hunger. So it is proving to be difficult to keep people inside because they have really nothing left to lose by going outside. There are also isolated reports of religious congregations going ahead. This is a time of year where there are a lot of Hindu festivals, and there are frequent reports that people have defied the lockdown order to go out and celebrate. But that said, for a country of 1.3 billion, it's been a surprising success. And epidemiologists have told us that this lockdown may have reduced the overall toll from the coronavirus in India by between 25 and 50%. It's also really slowed down the rate that the disease is spreading in India. So had there not been a lockdown, epidemiologists projected the peak would come at the end of April, and they feared that the Indian government would just simply not be prepared for that. But instead, because of these two back-to-back lockdowns, which will effectively have kept people indoors for 6 weeks, they think the peak may now not arrive until June. And they hope that by then, the government really will have its act together, will have bolstered its capacity for a surge in patients, will have enough PPE, will have enough isolation units to, again, to avert really the disaster that some fear we still might see.
So the last question I'll ask you is, Prime Minister Modi has been a very popular leader in India, very high approval ratings. Is there any indication that that might be changing with his handling of the outbreak?
Yeah, I think it's a bit too soon to tell. He's only in the first year of a 5-year term that he won in an election last May. So it's very early politically to really gauge how this will affect his legacy or his ability to stay in power. I think for the most part, the lockdown and the relative success of the lockdown speaks to his popularity, speaks to his sway, and his ability to convince people that this is part of a national project and to do things in the national interest. I think the collective ethos that he is able to tap into is really, really strong and has remained strong. Obviously, I think if there is catastrophe that results because of the government's missteps, it will affect his ability to rule. It will affect his political agenda going forward. But my instinct tells me that Modi is probably going to come out of this, if anything, in a stronger position.
Emily Schmall is AP's South Asia correspondent. She is based in New Delhi. Emily, thank you so much for joining us today and giving us some insight on what's going on with the pandemic in India.
Sure, my pleasure.
Today at apnews.com, our one good thing is a story about a professional cyclist. David Martinelli misses the competitions with fans lining the road and teammates providing support, both physical and emotional. There are no races to win these days, but he has achieved a moral victory. Martinelli has been using his bike to help deliver medicine to elderly residents in his hometown in northern Italy during the coronavirus pandemic. Read that story and all of AP's coronavirus outbreak coverage at apnews.com.
That's it for this episode of Ground Game. We'll be here every step of the way during this extraordinary moment in American politics and American life, giving you all the news you need to know. Be sure to tell a friend about us, and please subscribe on Apple Podcasts and leave us a review. Some of the details of our discussion may have changed by the time you hear this. For up-to-date developments on all of your news, head over to apnews.com. From the Westwood One Podcast Network.